Thank you, Corla. I wanted to raise an issue with the Department of Health and the Minister today that I know they are well aware of, but it's so important that I think it's worth highlighting again. My constituency of Dublin Central is home to the Rotunda Hospital. The Rotunda is in fact the busiest maternity hospital in Europe. In 2019, they delivered more than 8,000 babies. In the same year, more than 1,300 of those babies needed to be admitted to neonatal intensive care unit for care. They run the hospital on a break-even budget, and they provide incredible care to families at a very important moment in their life. And indeed, they've won awards for their innovative care practice. They do all of this in a building complex that dates back to 1757. Now, it's a much-loved building in Dublin Central, but it is an old one nonetheless. In short, they are attempting to provide 21st century medical care in an 18th century infrastructural setup. The situation is now very serious and of particular concern in relation to the provision of best practice care in the neonatal intensive care unit. A number of reports have pointed to the suboptimal conditions in our maternity hospitals and pointed to inadequate space and outdated facilities. Nowhere is this more critical than in the Rotunda. We know that the standards of buildings impact the quality of care and therefore the outcomes of that care, and that this is a false economy because, Minister, we know that the cost to families and the cost to the state when things go wrong. HICWA has repeatedly stated that we need capital investment in modern maternity facilities and buildings, and that investment must be timely. Babies in neonatal care are the most vulnerable patients that I can think of, and the current situation, the physical infrastructure in the Rotunda, is not best practice in NICU facilities, and particularly as it relates to infection control, which is so meaningful for all of us at the moment. I'm imploring the HSE and the Minister to address overcrowding in the Rotunda neonatal intensive care unit in the short to medium term. In 2019, the Director of the Rotunda warned that the overcrowding was an intolerable patient safety crisis. The Rotunda takes babies from all over Ireland into their care, and they're doing their best, but they're now doing their best under unacceptable conditions. The Rotunda management do have a plan to tackle this urgent need. I'm aware that in the long term, maternity hospital services will be moved to the Connolly campus, but the 1,300 babies who need care every year need to be safe and cared for now and to the best of our ability, and they can't wait that 15 to 20 years. There is a significant business and medical case for the immediate development of a critical care wing on Parnell Square, which could mitigate current risks in the medium term. This will be compliant with government policy and has been approved by Dublin City Council Planning Department already. The estimated cost of the wing is 61 million, though I accept procurement costs at the moment are currently difficult to ascertain and be definite about. I want to make this last point. I know that there is a long-term plan to move the Rotunda, but investing in a medical care building now would still be an efficient use of public money. The inner city would have a high-quality medical building into perpetuity. We would get 15 to 20 years of safe NICU care for our most vulnerable babies, and it's really only the commissioning cost of less than 5 million that would be non-transferable. I think this is an excellent business case for the wing. As we've heard this week, in Ireland, we haven't always cared for our most vulnerable children the way that we should, and I hope the HSE and the Minister for Health and yourself will consider my points.
Deputy Horrigan, thank you very much for raising this important matter. I can be forgiven for saying I'm particularly pleased to hear you raise it, because I was born in that same place myself, a little bit after 1757 though. Minister Rabbitte.
Thank you, Corla, and thank you, Deputy Horrigan, for raising, as the Corla said, this very valuable topic here tonight. I'm taking the question on behalf of the Minister for Health, and the script I have is on behalf of the Minister for Health. So I do thank you, the Deputy, for raising this issue and giving me the opportunity to outline to the House the position in relation to neonatal services at the Rotunda Hospital. As the House is aware, the Rotunda is one of the oldest and Ireland's busiest maternity hospital. Annually, over 8,000 babies and 1 in 4 of all the babies requiring neonatal intensive care in Ireland are born there. Consequently, the Rotunda cares for the most vulnerable, fragile infants at the very extremes of prematurity, as well as sick babies with very complex needs. The challenges faced by the Rotunda to provide such a critical service are well documented, and as Deputy Horrigan has laid here as well. In particular, given the age of the buildings, the infrastructure of the hospital presents significant difficulties in terms of infection prevention control and patient safety. I am aware the Deputy will be aware that in the medium term the Rotunda will be co-located with Connolly Hospital, and this is in line with government policy as articulated in the National Maternity Strategy. That is in order to ensure an optimum and safe service. All standalone maternity hospitals should be co-located with adult acute hospitals. Indeed, the relocation of the Rotunda to Connolly is included as a commitment in the programme for government. It goes without saying that the health and the safety of mothers and babies in our care is always of the utmost priority. It is acknowledged that there is a need in the short term to address the highest infrastructural risk and capacity issues at the existing hospital at Parnell Square. However, given the plans to redevelop the Rotunda, we need to ensure that an interim development and investment must be limited to the extent necessary to address priority patient safety risks. There has been significant engagement between the Department of Health, the HSE and the Rotunda in an attempt to clarify the scope and the extent of the developments needed at the Rotunda to resolve patient safety risks arising from infrastructural challenges at the hospital. In 2020, £4.6 million was provided to the Rotunda Hospital to address capacity and infrastructural needs in the fetal assessment unit, neonatal intensive care unit, emergency theatre and delivery suites. Given the age and the condition of the original hospital buildings, however, issues remain, and in the context, the Rotunda has proposed a new development which will address identified key clinical risks. Additional funding of £100,000 was provided to the Rotunda in 2020 to prepare a strategic assessment report and a preliminary business case in support of the proposed development, as required under the Public Spending Code. And I am advised that these reports have now been submitted to the HSE and are currently under consideration. I do also understand that the HSE intend to allocate an additional capital funding of £250,000 to the hospital this year to further assist to progress proposals to address areas of critical risk, with a particular focus on the neonatal intensive care unit. The investment will help ensure that the hospital is facilitated to make the necessary plans to ensure that babies born in the Rotunda continue to receive the safest, high-quality specialised care possible in advance of the Rotunda's move to Connolly.
Thank you very much, Minister. Deputy Horrigan.
Thank you, Ceann Comhairle. And just to say, I share your fondness for the Rotunda. All three of my children were born in the Rotunda, one with only seconds to spare, so I think it's very special to many of us. I welcome the Minister's response, and I'd like to say that the Department has engaged with the Rotunda, and we welcome that. Just to be clear for people, the best practice in NICU care is that every child would have 16 metres square, and at the moment in the Rotunda that's 5 metres square, and that impacts on children's care, but also, the amount a mother can engage with her child and how many people can be in the room. So it is very, very urgent and very, very serious. I have a very specific request. I think the Minister and the HSE can see that there is a viable business case here and a medical argument around the critical care wing attached to Rotunda, even with that kind of deadline of the move over to Connolly. 15 to 20 years is a long time to have a difference of that kind of space of 16 metres square versus 5 metres square for those incredibly vulnerable babies. I'm also aware that the Department of the HSE has a number of processes to go through in terms of cost-benefit analysis before they would consider something like this or give it the green light, and that's as it should be. For the project to proceed, one of the first steps is to complete Gate 2 of the Public Spending Code, and that is the completion of a final business case and initial planning document and design. This requires financial support, I believe more than 250,000. It's somewhat more than that, and I would hope that the Minister, Minister Rabbitte, and thank you for spending your time here today to answer, could communicate back to the Minister for Health our genuine ask that they would consider supporting even just that next stage, that Gate 2 of the Public Spending Code, that we could at least move forward with the cost-benefit analysis for the NICU unit.
Thank you, Deputy Horrigan. Minister.
Thank you, Corla, and thank you again, Deputy Horrigan. And I will take on board exactly what your request is here this evening. I will articulate it to Minister Donnelly, and perhaps I could facilitate a meeting between yourself and Minister Donnelly and our new General Secretary acting over in the Department of Health, who has come from deeper, who would have a really good understanding in relation to the Gate 2 process that you are talking about.